Namaskar. I am Dr. Aratrika Das, consultant pulmonologist practicing in Kolkata, India. The world has been taken by storm after the coronavirus infection since December 2019. There was an initial peak of COVID illnesses in 2020, which had killed many innumerable people across the world, mostly in the Western countries, and which had caused irreparable financial loss to many people. After that particular peak came down, which took almost 7 to 8 months to come down, a second peak of coronavirus caused disease came up from January 2021, I'm sorry. So this year also we are all facing the same problems of coronavirus related disease causing injury to the lungs, to the gastrointestinal system, and to the neurologic system. Also, many cases of cardiac illness arising out of coronavirus infection has also come to our notice. So, is it that we haven't really learned anything from last year's COVID disease? No, it's not that. There is a big difference in presentation and sequelae of COVID infections between 2020 and 2021. 1 year back, it was like either the patient would get well or the patient would die. Once the patient gets well, he is well for his life. This year, it's not so. It's much worse than what was there in 2020. This year, the number of people affected by the coronavirus have increased by maybe 5 times. The severity of the disease has increased again by 5 times. And the most important and worst of all these, or in fact most of these COVID illnesses have left behind a sequelae to the body even after the active infection dies out. So even if the patient recovered from COVID, he or she doesn't really feel good enough to carry on with day-to-day activities. Today I am going to just tell you what could be the sequelae of COVID illness, not the signs, symptoms or treatment of COVID illness. That can be covered up in another sitting. Now, if we look at the sequelae of COVID illness, what could be there? The most important sequelae of COVID illness and the most common sequelae is headache and a permanent loss of smell or taste. This has happened and has been happening to many of these COVID illness patients. So the coronavirus, yes, can be taken care of by medicines, but it does leave a trail, and the trail makes patients suffer for years on end. Other minor sequelae like diarrhea, body ache, severe depression, inability to eat, anorexia, these things can happen, but the most important sequelae which we as pulmonologists are facing is breathing difficulty of the patients. And what is this breathing difficulty due to? Breathing difficulty is due to a fibrosis which sets in the lungs because of extensive damage done to the lungs by coronavirus. The patient's lungs are damaged in the sense, in the areas of fibrosis, the patients cannot have a good exchange of oxygen and carbon dioxide between the external air and the blood. So obviously the patient's hunger for oxygen increases and the patient becomes breathless. In most of these patients, they are breathless even while walking 1 or 2 steps. Some of the patients have mild levels of breathlessness. Apart from breathlessness on exertion, these patients also experience a dry cough, which is present both during the day and at night. Dry cough along with breathlessness and a tightness of the chest, heaviness of breathing, point towards fibrosis of the lungs. And this is not just bookish knowledge. We have seen all these things from our experience over the past few months. So what is to be done? If a patient has persistence of breathlessness or dry cough even after becoming COVID negative, the patient shouldn't think that, well, I am at home and I think now that I am negative for coronavirus disease, I will recover from this as well. No, the patient should definitely go and see his local doctor, family physician, or if he knows a respiratory specialist, please go and visit him. Because there are specific treatments to reduce this breathlessness on exertion and dry cough, and also to retard the progress of fibrosis in the lungs. Many of these patients might require oxygen at home, domiciliary oxygen, even though he may be COVID negative. So, an arrangement for giving them oxygen, maybe low flow oxygen, usually at home continuously or throughout the night for at least 14 to 16 hours is essential. Apart from oxygen, there are certain drugs which can decrease the progress rate of fibrosis in the lungs. So those medicines need to be taken, but definitely not without the consent of the doctor. Those medicines include 2 main groups of medicines. One is pirfenidone and the other one is nintedanib. They are a bit expensive medicines as compared to usual drugs like paracetamol or maybe drugs to reduce breathing difficulty, but the other drugs will not really act in this situation. This situation is only brought under control with particularly pirfenidone and nintedanib group of drugs. Apart from breathing difficulty, these patients can also have some neurological sequelae, say tremors of the limbs, gait disturbances. These can occur in COVID positive patients as a sequel even after the patient becomes corona negative. Other things like diarrhea. Yes, diarrhea can also occur, but the percentage of patients experiencing long-term diarrhea is very less. All patients do not recover in those 17 days quarantine period because there is also something known as a long COVID. And patients who have this long COVID may remain COVID positive for weeks on end. So, what do these patients do? Yes, they are very less infective to others, but they do carry some load of the viruses. Maybe a less load, but they do carry the load of viruses. So, these patients need to be under constant supervision of their doctors so that they do not spread the infection of coronavirus in community. The other thing that remains is severe weakness of these patients. This is a very common sequel of COVID related disease. Severe weakness, so much so that many of these patients fail to get up from a lying down position for weeks on end. So in these patients, one has to realize that the patient is not feeling weak by his own will. It is because of the coronavirus disease that the patient is feeling weak. And they need to be given adequate rest, plenty of fluids orally, and yes, sometimes vitamins, vitamin B complex and vitamin D. Vitamin D is of vital importance in reducing weakness in the post-COVID phase. So this is about the post-COVID sequel which patients need to look into before calling it quits from the doctor's chamber. Thank you very much.